Scene script. Ever pondered the intricate details of syphilis, a sexually transmitted disease caused by the bacterium Treponema pallidum? This infection, if left untreated, can wreak havoc on various body parts, including the skin, mucous membranes, nervous system, and cardiovascular system. The potential severity of untreated syphilis can even result in death. So how does this bacterium spread? Treponema pallidum transmits through direct contact with the open sores of an infected individual, most commonly during unprotected sexual intercourse. The progression of syphilis usually unfolds in 4 stages. In the primary stage, a painless sore known as chancre appears, typically in the genital area. However, it can also emerge around the anus, mouth, or skin. This round coin-sized lesion, with its red or gray color and hard or soft texture, can disappear after a few weeks. Nevertheless, the bacterium remains within the body and can infect others. The secondary stage follows with systemic symptoms such as fever, chills, headaches, muscle aches, and fatigue. A rash, usually red or brown, may appear anywhere on the body, sometimes accompanied by sores or pus-filled pimples. Although these symptoms may disappear after several weeks or months, the bacterium still lurks within the body, potentially progressing to the 3rd stage. The tertiary stage involves more serious damage to the skin, bones, liver, cardiovascular system, and nervous system. Skin lesions may include sores, nodules, or large ulcers. Bone damage can result in joint pain and deformity. Liver damage could lead to liver failure. Cardiovascular damage can cause heart inflammation or valve narrowing. Damage to the nervous system may result in facial paralysis, hearing loss, or memory loss. The final stage, known as latent syphilis, presents no symptoms, yet the bacterium remains within the body and can still infect others. This stage can occur at any time following the primary stage. Diagnosis of syphilis involves a clinical examination where the physician will ask about your sexual history and symptoms and conduct a general examination. Various tests can be used to diagnose syphilis, including direct tests that examine samples taken from sores for the bacterium, blood tests to detect antibodies against the syphilis bacterium, and urine tests to find the syphilis bacterium. Treatment for syphilis typically involves antibiotics. The type of antibiotic and duration of treatment depend on the stage of the disease and the patient's health condition. It's crucial to treat both sexual partners, even if they show no symptoms. To prevent further spread, abstain from sexual intercourse until both you and your partner have completed treatment and receive physician's approval. The best way to prevent syphilis is by using condoms during every sexual encounter. Limiting the number of sexual partners and avoiding sexual contact with those at high risk of syphilis is also advisable. If you suspect that you may have been exposed to syphilis, seek medical attention immediately. Remember, syphilis is a dangerous infectious disease that can lead to serious complications if not treated promptly. These complications can include infertility, cardiovascular diseases, neurological disorders, and even death. If you exhibit any symptoms of syphilis, consult a physician immediately. Adhering to preventive measures can help avoid contracting syphilis.